Psoriasis is an autoimmune disease that currently has no cure. For many of us who are diagnosed, it is often a lifelong condition that requires a long-term treatment strategy. There are many options to choose from, ranging from topical medication that you apply on a specific area to systemic treatments that target the entire body. However, if you're unable to or decide against treatment, I will share some home remedies that I have personally tried towards the end of the video. The strength of treatment can be defined in a few ways, and knowing when to move up can be a simple decision or one that takes more thought. Treatments may also lose effectiveness, so switching and trying other treatments is common practice. Sometimes your dermatologist will decide when to switch to a stronger treatment if it involves potency or dosage. Other times, you may be given several treatment options to choose from, and you will have to make that decision yourself. Most people who are diagnosed with psoriasis start with topical medications. These are your creams that you apply on a specific spot and are usually the first line of defense. There are ones that come with steroids and ones without. Regardless of the type, never buy from unknown sources, and please be extremely cautious if you ever decide to buy natural solutions online. Knowing when to move up the topical steroid chain is quite simple, because the dermatologist will generally make that decision for you. It's quite easy to tell if a topical medication isn't working. If the area you're applying it on continues spreading, then it should be a clear sign that a stronger topical medication is required. I've used several strong steroids for my psoriasis over the years. Proper use of steroids is important to prevent side effects, and overuse can be dangerous and lead to withdrawal symptoms. Eventually, if your psoriasis continues spreading, you will find yourself needing to move away from topical medications and into a different form of treatment. This is where phototherapy or systemic oral medication becomes an option, as they are used to treat moderate to severe psoriasis. Moving up to this second line of defense requires more thought, because the potential side effects they carry are much more severe. Phototherapy, for example, carries the increased risk of skin cancer, whereas methotrexate and cyclosporine can cause liver and kidney damage. These treatments are also more time-consuming due to the need for multiple visits and checks. And in the case of phototherapy, you need to go back 2 to 3 times a week for it to be beneficial. I was given these options to choose from as my psoriasis coverage became so big that topical steroids were not effective anymore. I decided to go with phototherapy first, as I did not want to take any pill just yet. I knew that phototherapy had done all it could for me after it cleared the psoriasis patches on my body, but my legs have yet to change. That is when I asked for another treatment to try, and azathioprine was offered. My most recent treatment was using cyclosporine, but I was also given the option of methotrexate. I chose based on how fast they work, which cyclosporine wins in that regard. Finally, if you wish to try treating psoriasis naturally instead, these are what I have personally tried and documented on this channel. I do not recommend that you follow what I do because there is no scientific proof that they work. I am only sharing my experience. Worst case scenario, your psoriasis becomes worse as a result. But if you still wish to proceed, always ask your doctor first and try at your own risk. Firstly, for my scalp. Many years ago, I came across people on YouTube recommending apple cider vinegar as a natural way to heal scalp psoriasis. And of course, I was curious. The gist of this treatment is to simply apply diluted apple cider vinegar on your scalp, let it sit for a while before washing it off with your shampoo of choice. What I've done is to dilute 1 part apple cider vinegar to 2 parts of water, and then I spread it on my scalp, leaving it on for 15 to 20 minutes before washing it off. I did this every day and I was not on any other treatment. It worked surprisingly well for my forehead, and the difference was quite obvious. However, it did nothing for the thicker plaques on my scalp. Before I started the apple cider vinegar treatment, I tried black seed oil. I did not have good results with this, so proceed with caution. Black seed oil was said to have many healing properties, so I wanted to test it as well. I heated up the oil and applied it to the thicker scales on my scalp. I then wrapped up my head with a shower cap and I left it there for 6 hours minimum. I did this for 7 days but had to stop because my scalp became even more red than before. It was also becoming itchier. Lastly, While waiting for my first dermatologist appointment, I also tried to heal my psoriasis naturally by simply leading a healthier lifestyle. I exercised regularly and ate normally, avoiding my known food triggers. I did not follow any extreme diets or special routines, and I did notice signs of healing in certain areas. All these changes occurred without any treatment, creams, or pills. Unfortunately, I cannot say for sure if my psoriasis will eventually go into remission just by doing this, because I started cyclosporine soon after. I have documented everything I've done for my psoriasis during my most recent flare-up, so if you are interested to find out more about the apple cider, black seed oil or cyclosporine, feel free to check them out.